Hi, my name is Richie Daniel and I'm a student physical therapist at Campbell University. Today we're going to be talking about the posterior medial displacement with valgus stress test of the knee. This test is going to be checking for the posterior medial instability. And the possible structures that are damaged are the PCL, the posterior oblique ligament, the MCL, posterior medial capsule, and ACL. So this test could ring positive for damage to any one of these structures, or even a group of them or a combination of them. So it's important to also perform a further battery of tests afterwards using our single planar tests like the valgus stress test and the varus, or the posterior drawer test and anterior drawer test to identify which structures are specifically injured. Another thing to know about this test is the fact that it also checks for the posterior oblique ligament that could be injured, and there's research out there that supports that the posterior oblique ligament and the posterior medial capsule have a significant role in the prevention of additional posterior tibial translation in the knee with posterior cruciate ligament injuries. The posterior oblique ligament should also be addressed in the patient with combined injuries to PCL and the posterior medial structures. So this is my patient right here, Nate, and I'm just going to explain to Nate real quick what I want to do. Nate, so I see that as you walk, you're having a little bit of issues at your knee. So I'm going to just perform a test to see if there's any structures that could be possibly damaged. So in order to perform the test, you want to make sure you grasp the distal end of the leg with one hand and have your other hand right at the joint line. So we want to start from a very slightly flexed, and you want to, the direction of the force is going to be posterior and medial, so it's going to be going down that way. And you want to make sure you're going towards full extension. So it's going to look something like that. So Nate, I'm just going to push down, and I want you to know if there's any pain or any symptoms that could be reproduced with it that you've had in the past. But a positive test is actually a sag of the tibia. So this is how the test is going to look. Any pain or any reproduction symptoms of this, Nate?
Nope.
No. So Nate has no symptoms regarding his posterior medial structures.